serving Virginia, Maryland, and the District. This is WUSA 9 News at noon.
Still ahead on 9 News at noon, it is the third leading cause of death in America. And that's why Fishman Alexandria Hospital has opened a new stroke unit. We'll have full details when we come back. Plus, let's talk about a local issue. This is the leading cause of disabilities. It is the third leading cause of death in the United States. And each year, about 200 people in Alexandria will be treated for strokes. That figure led Fishman Alexandria Hospital to create a new stroke unit. And here to talk about it is Dr. Simon Fishman. He is the stroke unit team leader. Thank you for being with us. You're very excited about this because it's very new, isn't it?
Yes, this is the leading recommendations for acute stroke care that comes from the American Heart Association, American Stroke Association, and we're the first hospital in the region to fully implement those recommendations and develop a stroke unit.
We congratulate you. Let's talk about symptoms. What should we be on the lookout for if we think we are going to have a stroke?
Yeah. It's very important to have a low threshold to go to the emergency room, and especially if anything suddenly changes in the ability to converse or understand, move your arms or legs, balance problems, or even just a severe headache for people who don't have headaches should all be warning signs for stroke, and you should come in right away. And the key portion to remember is call 911. This is not something you want to get stuck in traffic waiting for to get to the emergency room.
You really need an ambulance to get there as quickly as possible, and that's important. It's important for you to seek medical treatment quickly because
there's, as opposed to 5 years ago, in the last 5 years, there's been development of clot-busting drugs, also known as TPA, which can be administered in the first 3 and sometimes the first 6 hours to actually reverse the stroke and leave people without any impairment.
I see. So you want to get there as quickly as possible. Now, let's talk about what we can do to prevent strokes. Any tips?
Yeah, this is very important because primary prevention, we talk about primary prevention being somebody who's never had an episode, and secondary prevention after you've had it. But primary prevention is very important. And many of the risk factors are the same risk factors that we have for heart disease. You need to control your blood pressure, your weight, for people who are diabetic to get excellent blood sugar control, and regular visits with your doctors to monitor health, your general health and reduce that. And the same recommendations that go for heart disease also go for stroke, with a few differences, but for the most part the same.
Doctor, again, let's go back and talk about the stroke unit. How many people are going to be working in it? What will they be doing?
Well, one of the things that we changed, we expanded a care unit from 6 beds to 8 beds with each private room. We have 2 to 3 nurses there at all times, so the ratio of nurses to patients is very high for a hospital non-intensive care unit. And the idea is to recognize people who are evolving or at risk for having a stroke early, get them treatment as fast as possible, get them evaluated, and also reduce, for those people who had a stroke, reduce the size of the stroke and therefore improve their likelihood of returning home.
Well, we congratulate you for this breakthrough in having this stroke unit. We hope that you don't have any patients, though, but we know that you're going to give great care in that unit. Thank you for coming on, sharing that information. If our viewers would like more information on the stroke unit at Fishman Alexandria Hospital, this is the number to call, area code 703. The number is 504-3605. 504-3605. And then you can also go to our website, WUSATV9.com. Click on news links. We'll provide more information for you there.